Hello, everybody, and welcome to another episode of Psych Talk. Today's episode is very exciting because it's all about babies and pregnancy. And I think it's very important for people who are planning to have kids in the future, pregnant people, and in general, people who want to know more about pregnancy, babies, etc. So the topics that I will talk about are delivering babies at hospital versus at home with a midwife. I will talk about mother and infant connection. I will talk about teratogens, which are environmental agents that are very harmful to the baby when the mother is pregnant. I will talk about SIDS, sudden infant death syndrome, and how to prevent it. And I will talk about the back to sleep movement. So let's start with delivering babies at hospital versus at home. Nowadays, many mothers are deciding to deliver their babies at home with a midwife instead of going to the hospital for many different reasons. So the US ranks 26 in the world in infant mortality with 6.1 deaths per 1,000 live births in 2010, which is very concerning because the US is a first world country, right? What are some of the reasons? So I'll talk about the reasons, but first of all, I want to mention that many studies found that nurse midwife assisted deliveries were much less likely to involve babies who had low birth weights or who died at birth or within the first week of life. Okay, so the reasons why is because in hospitals, nurses and doctors very easily give drugs to mothers who are about to deliver the baby or during labor. And such drugs are anesthetics, which dull the overall feeling, analgesics, which reduce the perception of pain, and sedatives, which reduce anxiety. So these drugs are very, very risky, and they are associated with complications, and they're not supposed to be given to pregnant women when they're delivering or when they're in labor, but they're easily prescribed to them. And same as PET, which is Pitocin, and it's a drug that is given to mothers to induce labor, and it should only be used when the baby is overdue. But unfortunately, that is not the case. So hospitals are a business, and they want as many people as possible out of there quickly. And they don't really want to wait for the mother to start labor. So they will induce labor with PET. And PET is also a drug that is not supposed to be given to mothers when they are pregnant because it's not healthy for the baby. So both PET and other painkillers are associated with complications during pregnancy. But for some reason, again, doctors and nurses, they do give those drugs very easily to women. And the problem with that is that, when a mother is pregnant and goes there and she's about to have a baby, they really do trust the doctors and the nurses because they should know better. And they're also in pain. They're not thinking, oh my gosh, they are harming my baby, right? So I want mothers to know that they do have choices and they do have options. So when you're scheduling your delivery day, you can always tell the doctors, I do not want to, I don't want to get drugs. I don't want to use PET to induce my labor. I don't want to use painkillers. I want my delivery to be done this way, that way. So you always have choices. It's just that many women don't know. They just go with the flow and they trust the doctors and their nurses, which is completely normal, right? But that is why many women are deciding to have kids at home with a midwife. It feels more natural to them. It feels, more comfortable that they're taken care of. However, this is my personal opinion. I think that in the future, when I will have babies, I'm not going to deliver my babies at home, just because in case of complications, you need to be at a hospital. That will be the only reason. And also the fact that you do have option, you just need to talk to your doctor, talk to the nurse about them, and make sure that they do not put anything in your body without your consent, basically. I also want to talk about the mode of delivery, because that's very important. Natural births are healthier for both the baby and the mother because, for instance, through natural birth, the baby is exposed more to the mother's microbiome, and it's important for the function of immune, hormonal, and metabolic systems. Naturally delivered babies have higher concentrations of good microorganisms, whereas babies delivered by cesarean section have higher concentrations of the pathogenic ones. Furthermore, cesarean section could lead to many complications later on for both the baby and the mother. And again, cesarean section should only be chosen if there are no other options for the mother, because the baby is not turning when the head is not towards the fallopian tube during delivery, which can be very dangerous for the baby. And also if the umbilical cord is around the baby's neck, that can be very dangerous. So those should be the cases for cesarean section, but nowadays doctors allow mothers to schedule their cesarean section, and I think that people should know what the complications of it, because there are many complications that you will not get with natural delivery. One other thing that is very important is that both mothers and fathers should be aware of is that holding and having skin-to-skin contact with a baby as soon as he or she is delivered is very important, because that is the first bond the mothers have with the infant, and that helps to build connection later in life. And in the past, many nurses wouldn't give right away the baby to the mother when delivered, but that's a thing that you have the choice to do. You can make a choice, and you can tell the nurse, I want to see my baby as soon as I deliver. And it's something that I think everybody should do, because it's very, very important to build this first connection with your baby, both for mothers and fathers. One other thing that is very important to talk about is breastfeeding. So breastfeeding also helps with bonding, because it releases oxytocin, also known as the love hormone. And it's very important because mother's milk have all the essential nutrients in order for the baby to grow healthy, and the formula lacks of that. And furthermore, the first milk that comes out from the mother after delivery is full of antibodies, and it's called colostrum milk. So I just want to recap a little bit what I said, is that basically mothers really do have options when it comes to choosing how they want to deliver their baby, and they can talk to the doctor, talk to the nurse. I don't want to take drugs, I don't want to take PET, I want to do a natural birth. I want to hold my baby as soon as I deliver. I want my husband to hold the baby. So that is very important. The next thing that I will talk about are, let's see. So I want to talk about SIDS, which is sudden infant death syndrome. So babies who are at risk of SIDS are babies who are placed on their stomach or side during bedtime. Babies who have stuffed animals in bed also, and blankets or soft pillows. Babies who are formula fed, and also mother smoking during and after pregnancy could be one factor. So in the 90s, there was this movement called Back to Sleep movement that was specifically to push mothers to put their babies to sleep on their backs to prevent SIDS. So you shouldn't put your baby to sleep on their stomach or on the side, but you should put your baby to sleep on their back so that you prevent sudden death syndrome. The only problem with putting your baby to sleep on his or her back is that it prevents them from strengthening their neck muscles, which delays their developmental milestones. However, there is another way to strengthen their neck muscles, and it is called tummy time. And during tummy time, babies are placed on the ground on their stomach so that they are forced to look up, which leads to the strengthening of the neck muscles. Another thing that I want to touch upon is how to help colicky babies. So research shows that massaging your baby can improve digestion and distress, and you will notice that they will also start crying less. And in general, even if it does not only help colicky babies, but also babies who are healthy. So massaging your baby helps build a strong connection between the baby and the mother. Also, one more thing research shows is that babies who are carried around more and kept against your body cry less compared to babies who are placed on a stroller. So really hold your babies. Give a lot of love. The last thing that I will talk about is I want to talk again about teratogens and how can really cause many complications if mothers are exposed to them during pregnancy. So, for example, smoking cigarettes cause neonatal death, spontaneous abortion, or abnormalities of the body. Alcohol can cause fetal alcohol syndrome, which basically leads to abnormally small head of the baby and underdeveloped brain, face malformation, congenital heart disease, and more. Weed, as I said before, is one of the most commonly used drugs among pregnant women and can cause placenta growth issues. Cocaine can cause intellectual disabilities. Meth, decreased fetal size and growth. Heroin and methadone, so they can cause premature birth, lung disease, and the babies will also be addicted to the drug when they're born. Caffeine as well is a teratogen, so women shouldn't really drink coffee or teas or anything that has caffeine because it can cause low birth weight and also miscarriage. And this is another problem that I still don't understand why doctors do that, but they do tell pregnant women that it is safe to drink 1 coffee per day, and I think it is better not to risk it. I think it's better to not drink coffee at all, also because, as you may know, many foods have caffeine, So maybe mothers are consuming, chocolate or other foods that have caffeine, plus the cup of coffee a day that they consume because a doctor said that it's fine to consume a coffee per day. 65 to 94% of women take at least one prescription drug during pregnancy, which is concerning. And the last thing that I'll talk about is thalidomide, which is now we know it's a teratogen. It was a medicine that was prescribed in the 50s and 60s to prevent and control nausea. It was prescribed to pregnant women, right? And then later on, we discovered that caused babies being born with deformed limbs, basically babies with no arms, no legs. If you want to, you can tap on the internet thalidomide side effects on babies, and you will see many images of babies being born with no arms and no legs. It's quite disturbing. Yeah, that's all for today's episode. To recap everything, we talked about teratogen, which are environmental agents that increase the risk of serious abnormality of the fetus. So don't smoke, don't do drugs, don't drink caffeine, don't take, prescription drugs. We talked about hospital delivery versus home delivery. Remember, you have the choice to not take drugs, to not take PET. You have the choice to do a natural birth. And then we talked about the connection between the baby, the infant, and the mother. It's very important because it's the first skin-to-skin contact that the baby has with the mother. So as soon as the baby is delivered, the mother should hold the baby. Breastfeeding is very important because it releases oxytocin, so it's another way to bond with your baby. And also it has all the essential nutrients that a baby needs to grow healthy. Then seeds, we talked about seeds, sudden infant death syndrome and how to prevent seeds. Put your baby to sleep on their back. And then we talked about tummy time to strengthen the neck of the muscle for babies. And that is it for today. This is a very casual episode. I just wanted to talk about important topics that I think everybody should know and should be aware of. I hope you have a good day and see you on the next episode.